Dr. Mosconi, as you know very well, one of women's biggest fears at this age is also Alzheimer's, probably with good reason, right? Aren't women two-thirds of women are
Yeah.
two-thirds of Alzheimer's patients, right? So we are more likely to get it. We're terrified of it. We have brain fog symptoms in perimenopause and menopause that make us think we're getting it. So much to ask, like what we can do to prevent it. However, what we've heard recently is this fear about hormone therapy and Alzheimer's. Can you sort of unpack that for us?
Glad, yes, happily. And yes, it's something I've been dealing with for a couple of years. And every day there's a new headline, and it feels like people are really determined to prove that there's something wrong with taking hormones. And I'm not sure where that's coming from, but when it comes to Alzheimer's disease, we and others have shown that menopause can be a risk factor for developing Alzheimer's disease for some women. So what is a risk factor? What is a cause of disorder? Something that causes a disorder makes you sick. The risk factor may increase your risk, right? So it's like you have blue eyes, you have a higher risk of being damaged by the sun unless you wear sunglasses. That's a risk factor. So menopause acts in a similar way in that it puts the brain in a vulnerable position for some time, during which if you have a predisposition to Alzheimer's disease or to other disorders, that predisposition may materialize as something measurable. Like we can see Alzheimer's plaques appear in women's brains as women start perimenopause, not after the last menstrual period, prior. So is it every woman? No. At the end of the day, about 20% of women develop Alzheimer's disease, which I think is too much, but this is the pushback I get all the time. So I'm just going to put it out there. It's only, in quotes, 20% of women who develop Alzheimer's, 80% do not. So clearly there's other factors at play. Now, could we legitimately reduce the risk of Alzheimer's disease by taking hormones during the transition to menopause and afterwards to protect our brains? The vast majority of scientists I work with would say, yes, that makes a lot of sense. But then when you go and look at clinical trials and other studies, the evidence is mixed. And just recently, there's this group in Denmark who decided to terrify everyone by showing that in their cohort, there was an increased risk of dementia, not of Alzheimer's disease, of all-cause dementia, for those who were taking hormones before the Women's Health Initiative, so in the early 2000s. And those women were taking high doses of conjugated equine estrogens, often enough with a synthetic progestin. So it was a very specific type of hormone therapy, which is different from what is most widely used today, like a low-dose estradiol, preferentially transdermal, micronized or bioidentical progesterone. So it's not the same. And I think it's very important to realize that formulation seems to have an impact. What also seems to have an impact is timing, which Sharon was talking about before. So what we had done for peace of mind is that we've done a meta-analysis, which is a statistical integration of all available data. So we have more than, I think it was more than 6 million women in the analysis at this point, and I can check, but there was a lot of studies. Well, all the good studies were included in this evaluation. And what we have shown is that for women who start hormone therapy in midlife, in response to the symptoms of menopause, then the risk of future Alzheimer's, but also all-cause dementia, but specifically Alzheimer's disease, is actually reduced, especially for women with surgical menopause, which is exactly what Sharon was saying. Now, when you start taking hormones after midlife, which is like more than 10 years after the final menstrual period, then the studies are all over the place. And in general, estrogen-only therapy for women without a uterus has a neutral effect, whereas estrogen and progesterone therapy, if you start it more than 10 years after menopause, sometimes it's protective, more often it's not. And these studies are basically the Women's Health Initiative and a bunch of studies that were done at the same time. So just to piggyback on what Sharon was saying, I think it's really important to have this information because it looks like maybe professional societies did not have an integrated view of all the different studies. But I assure you, they are confusing. They're
Mm-hmm.
really confusing, and it's very complicated to pull them together, which took us quite a little time. A statistician was like, oh my God. But the results are quite encouraging. And I think they really speak to the need for more research so that we can have even cleaner clinical trials. Also, one thing that I really resent is that all the information we have looks at hormone therapy taken now, and the endpoint is whether or not a woman develops Alzheimer's. This is something that in my field nobody's doing anymore. We stopped doing that in the like early 2000s because that is just, how do we control for everything else that happened in those 30 years between midlife and late life? So what we are doing now is we're using brain imaging, we're using biological markers of Alzheimer's risk so that we can check whether hormone therapy in midlife has an impact on your brain in midlife. And I'm hoping to see, we're doing a clinical trial now too, actually. And I'm hoping to see a lot more research blooming in my field.